Hello all. In this video we'll be discussing about Vasa Previa. Vasa Previa is an obstetrical emergency. It means any condition that occurs during the antenatal, intranatal or postnatal period that requires an immediate intervention to save the life of the patient. So Vasa Previa is one such emergency. So the word Vasa Previa, it is consisting of two words, that is Vasa and Previa. So Vasa, it means blood vessels, and Previa means low lying. So you might be familiar with a condition called placenta previa, where placenta is low lying. But in this condition, blood vessels are low lying. So that increases the chance of rupture. So some blood vessels are low lying. The fetal blood vessels are low lying. So that is seen in Vasa Previa. So now let's see the definition of Vasa Previa. So it is an abnormality of the umbilical cord where one or more umbilical vessels cross or run near the internal orifice of the uterus. So we all know that the umbilical cord is consisting of three blood vessels. That is two umbilical arteries and one umbilical vein. So these vessels, these umbilical vessels will cross or run near the internal orifice of the uterus. So that is Vasa Previa. It is lying low in the uterus as the name suggests. So let me show you a figure. So this is the figure showing Vasa Previa where the umbilical vessels are lying near the internal orifice of the uterus. So what happens is normally this umbilical cord and the vessels of the umbilical cord is covered by a substance called Wartenstelli, which acts as a protection for the umbilical vessels. But in this condition you can see that the vessels are not covered by Wartenstelli. So that increases the chance of rupture of the blood vessels. So when the blood vessels rupture, what happens? The blood will ooze out, and this blood is the blood that has to go to the fetus. So fetus will get hypoxia because the fetus is not getting enough blood. Okay, so that is the main feature. Bleeding will occur. There is an increased chance of bleeding in Vasa Previa. Okay. Now let's see the epidemiology. So it can occur in 1 in 2500 to 5000 pregnancies. Then about the risk factors. So the risk factors include velamentous insertion of umbilical cord. So velamentous insertion of umbilical cord means normally the umbilical cord is attached towards the center of the placenta. But in some cases the umbilical cord will attach to the periphery of the placenta. So that is called velamentous insertion of the umbilical cord. Then previous LSCS, then low-lying placenta as in the case of placenta previa. Then bilobed placenta. So normally the placenta is having one lobe, single lobe, but in some condition it can have more than one lobe, two lobes, three lobes. Sometimes an accessory lobe will be present. Then in vitro fertilization and twin pregnancy. These are the risk factors for Vasa Previa. So this is velamentous. You can see velamentous cord insertion. So normally the umbilical cord is attached to the center of the placenta, while in velamentous cord insertion it is attached to the periphery. And this is the figure showing bilobed placenta. It is two lobes present. Now let's see the signs and symptoms of Vasa Previa. So normally Vasa Previa will not show any signs and symptoms. So it will become evident only when the rupture of the blood vessels occur. So there will be sudden onset of painless vaginal bleeding, especially during the second and third trimester. So bleeding can occur due to many other causes, we know. So like abruptio placenta, but here the feature is that it is painless vaginal bleeding and the color of the blood is dark burgundy color. That is very characteristic of Vasa Previa. That is because the blood vessels getting ruptured here is the fetal blood vessels. So the blood coming out is fetal blood. So we all know that we have learned about the fetal circulation. So the fetus is getting a mixed blood. So it is dark in color. This is because the fetal blood is darker than the maternal blood due to low oxygen levels in the fetus. So the dark burgundy colored painless vaginal bleeding is very characteristic feature of Vasa Previa. Okay. Now this is the classical triad of, this is very important, the classic triad of Vasa Previa, that is rupture of membranes, painless vaginal bleeding and fetal distress. Why fetal distress occurs? Because the blood vessels have ruptured, so the fetus is not getting enough oxygen. Though it can lead to fetal bradycardia. Sometimes in severe cases it may lead to fetal death. Okay. Now the diagnosis. So the diagnosis usually occurs when the rupture of the blood vessels occur. But before the rupture itself, we can diagnose this condition in transvaginal sonography in combination with color Doppler. It helps to detect Vasa previa as early as 16 weeks. So if a mother is having any of these risk factors, so we can perform a transvaginal sonography with the color Doppler that can help in diagnosing the condition even before the rupture. Okay, next about the management. So once the rupture has occurred, we have to immediately deliver the baby, because the fetus is at a high risk for distress and death. So we have to immediately perform an LSCS and deliver the child. And the prognosis that depends upon the period of gestation. So if the period of gestation is less than 35 weeks, then the prognosis is very poor, because the fetus will not be able to thrive. So the prognosis mainly depends upon the period of gestation. If the period is more than 35 weeks, it is good prognosis, and we have to monitor the fetal condition throughout the delivery process, and LSCS is the procedure that is suggested. Otherwise it will further lead to compression of the blood vessels, and further there will be more distress in the fetus. So that's why we are opting for an emergency LSCS. Okay. Then if it is diagnosed early, that is Vasa previa is diagnosed way before the rupture, then we have to monitor the maternal and fetal condition closely. So we have to monitor the fetal heart rate and the maternal contractions. We have to keep the mother hospitalized and maintain bed rest for the mother. Then administration of steroids. Why administer steroids? If the period of gestation is less than 36 weeks, we have to administer steroids for fetal lung maturity. Then elective LSCS at 36 weeks. So as delaying may increase the rupture of membrane. So as early as 36 weeks we have to perform LSCS. Otherwise, if we delay, like normally LSCS is performed at 37-38 weeks. So if we delay the LSCS, elective LSCS, there is increased chance of rupture and further complications. So we are performing is as early as 36 weeks. So this is all about Vasa previa. So it is an obstetrical emergency that causes painless vaginal bleeding, dark burgundy colored vaginal bleeding. So if it is diagnosed during the labor, an elective LSCS is performed, emergency LSCS is performed, or if it is diagnosed early, so for good prognosis, we can perform an emergency LSCS as early as 36 weeks. Thank you.